Blood pressure management for people experiencing acute stroke is probably one of the most challenging things to learn or understand when you're new to taking care of stroke patients. Also, it can be really counterintuitive because to prevent a stroke, we're really worried about keeping their blood pressure low and within normal range. But once a stroke occurs, the brain is really trying to perfuse all the areas that are at risk. And so it's trying to auto-regulate. It does that really well all by itself. And so sometimes we have to counterbalance it with some treatment. People who are admitted or being treated for an hemorrhagic stroke, the new updated Get With The Guidelines recommend keeping their blood pressure less than 150 systolic or greater than 130, kind of in this really narrow window acutely to prevent the recurrent bleeding or also to prevent hypoperfusion. For people who have gotten IV thrombolysis, it's really important to keep their blood pressure less than 180 over 105 because the likelihood of having a hemorrhagic conversion increases with a sustained blood pressure above that. But we also don't want their blood pressure to get too low because hypoperfusion is a real thing and can worsen a stroke, especially to damaged tissue. So letting it go up to 170 is great. That's fine. And then for people who have not been a candidate for any treatment but have had an ischemic stroke, their goal might be to keep their blood pressure under 220. We're really trying to perfuse that ischemic tissue and prevent it from expanding.